Hi, everyone. My name is Brianna Claverie. I completed my undergraduate studies at USC and earned my Master of Science at Charles R. Drew University of Medicine and Science. As a New Orleans native, I am proud to stand before you to present my research titled Pathways to Equity: Advancing Equity and Social Determinants of Health Through Pre-Health Education. The question seems simple yet urgent. If we want to reform our healthcare system, where does reform actually begin? So this brings me to my question. Who is remembered in medicine? Has anyone seen the portrait on the left or heard the name Dr. J. Marion Sims? Dr. Sims is often referred to as the father of modern gynecology. His surgical techniques for repairing vaginal fistulas advanced the field, and today we still use instruments such as the Sims speculum named after him. But those discoveries came at a cost. In the 1840s, Dr. Sims conducted repetitive surgical experiments on enslaved black girls without anesthesia. He often operated multiple times on the same girl in order to perfect his technique. Today, we can only name three of those young girls: Anarcha, Betsy, and Lucy. They are often referred to as the mothers of gynecology. While medicine is grounded in the Hippocratic Oath to do no harm, these girls were subject to profound harm in the name of medical advancement. Their bodies became the site of experimentation, not care. When I entered my biomedical sciences program, I realized many of my peers had never learned this dark history, and that realization is what fueled my research. Reforming healthcare requires reforming education. We all know that health disparities persist. Though cultural competency training is fragmented and education on equity often starts too late. We often talk about reforming the healthcare system, but we rarely talk about reforming how we train future providers early on. Many students enter medical careers with strong science backgrounds, but little exposure to social determinants of health, cultural humility, and historical roots of medical mistrust. As an undergraduate human biology major, I learned the biology of disease in depth, but I was never taught to examine the social and structural forces that determine who gets sick in the first place. I had to switch majors in order to learn about poverty, medical racism, and insurance inequities. Students should not have to stumble into equity education. If we want to reduce health disparities, we must start intervention early on. Through literature review, I found reports which show that resident training is often generic and not population specific. Equity education is often one lecture or training that most people click through, optional, or dependent on being from a marginalized background. Particularly, students who are not minorities often never encounter these topics. So, what's missing? Longitudinal, early, structured education on equity. We should not wait until medical school or residency to introduce structural competency and cultural humility to our future providers. So, this brings me to my research. Our intervention is called Pathways to Equity, a longitudinal three-phase health equity program designed specifically for pre-health students. This pilot program was implemented among pre-health students across Southern California with intentional recruitment of students of underrepresented backgrounds in medicine. Phase one focused on building foundations, including key concepts such as health disparities and the historical roots of medical mistrust. Phase two moved into interactive scenario-based workshops. And phase three extended the learning beyond the classroom. In partnership with Black Infant Health of Riverside County, students developed digital health equity campaigns addressing community-identified priorities. My research was conducted, and our thematic analysis revealed four major domains of growth within our students: social and environmental determinants, structural barriers to health, health literacy and patient navigation, as well as trust and cultural humility. Students should not have to be a minority, experience discrimination, or change majors to learn about health inequities. If we want a healthcare workforce capable of advancing justice, we must train them that way from day one. Reforming healthcare is not just about policy, it is about mindset formation. In closing, if we want to reduce health disparities tomorrow, we must reform how we educate our future providers today. Thank you.